welcome back. So today I thought we would look at our most important part of a dental nurse's occupation, which is our suction and our dental chair. So let's have a little bit of a look. So the chair that we use in this practice is called an ADEC chair. So let's have a look. Okay, so let's start over at the dentist side of things. Something you'll still be familiar with, and I'm also going to try and stop saying so much this video as well. So when you come into the surgery in the morning, this is our dentist side. Over here we have the on-off switch, which is just a flick. You'll hear the air start to whoosh through the chair. You'll see the chair light panel come on. That way you know that there is power coming to the chair. So across here, these are our hand pieces. So this guy here, this is the air and water that the dentists use. So it's just a button push here. You can hear the air go, and if you press this, water's gonna come out. So I'm gonna have to clean this up. Yeah, great. So moving on, this is the high-speed handpiece. It has this is just the adapter, obviously. The actual drill part clips onto this one here. Pop him back in. The slow speed handpiece adapter. This was something we talked about in one of my other videos about the cleans. So that clips onto here. That's the slow speed adapter, and the slow speed handpiece clips onto this. This is where the ultrasonic goes for a checkup and clean. That just clicks onto there. So that ultrasonic adapter clips onto here, and the ultrasonic head goes on top of the adapter. And they just live in the arm here. This is where your dental tray goes. There's usually a exam pack here, and this is the batch code that I talked about in one of my other videos. We had the old system, which was on the back of the pack. Here it's much more simple. It's got the batch code and everything, the date it was processed, and you just scan that in. And that's one of our trays that goes here. So this is the patient chair, as you can see. Now coming over here, this is our side. This is the fun of your career. Happens right here. So let's have a look. This is the water tank that filters water all through the chair. So you do need to make sure that this is full. If it's not, you just need to go out and fill it up using reverse osmosis water, sterilized water, or a little pill that sterilizes the water when you put it in there. Patient side, spittoon. Patient spits out any debris or mouth rinse into there. We've got our suctions here. So this is your be-all. Without a suction, it's a bit tricky to do your job. So we've got our high-speed suction. You click him on. You can hear him go. And we have the slow-speed suction. So we try to use these in conjunction. You'll also notice that we have our very own air and water dispenser here. So you can use that during dental procedures to help, during a restoration. You could use this to sort of rinse off the debris. So these are our go-tos, very important. Try to use these two in conjunction during a restoration or any kind of procedure. I try to use the high speed sort of to retract the mouth while it's going, and then I use the slow speed throughout as well. Sometimes I alternate, so use this one as the retractor and this one does my heavy lifting. So yeah, always try to use them both in conjunction though. So we've got our little cup. As I said, it's empty. So I like to fill that up when the patient's in the chair, ready to go. We also have over here, you might be able to see, it's very faint, but this is giving you the option to fill the cup or fill the spittoon. We also have the same corresponding buttons on our control panel here. This also operates the chair levels. So if we press here, that brings the water into the cup. If we press here, it brings the water into the spittoon. You just double click too if you want it to stop. This also operates the light. So we've got the light just here. You'll see that comes on. There's 3 different settings on this chair. So the yellow light is to prevent curing resins, light curable resins. And we've also got our operative light, which is that big bright light. So this controls the chair level. You know, if we want to lie the patient flat, we press the flat button. It's really self-explanatory, but it is important that you familiarize yourself with your chair and its operations prior to commencing. I think that's a really important one as well. There's also different parts to the chair in regards to cleaning. So there's a few different dental chairs out there. There's a couple of different brands. The big ones are Sirona and ADEC. We use ADEC in this practice. So for us, if we're going to go do maintenance to the chair, it lives in here. That's sort of the filter where the suction that sucks all the debris pops it into the little tank here. You take it out and you need to dispose of that in accordance with your practice's sterilization procedures. So yeah, we've gone over our chair. The two big ones are our suction and our water tank, remembering to have that filled. We've got our control panel, so we can sit the patient back up, make sure we're putting our chair in the entry position. We've got our dentist side over here with the control panel. We have our basic tray. We'll do more trays as time goes on. But yeah, so I hope that was helpful. We'll see how this turns out. But otherwise, happy nursing, happy assisting, and I will see you next time. Have a great day.